For me, it was not just about the assumptions that we're making about what providers need in improving access and the quality of diabetes care, but the assumptions that we're making about the capacities and backgrounds of the clients and patients that we're serving, and how that's really playing out in the lack of evidence or research that's been undertaken about populations that face barriers to accessing care, whether that's from cultural backgrounds or disabilities or mental health. That really any of the strategies had very little background, and as a result, some of the policy decisions that we're making and program decisions is really based on the assumption of what I find to be particularly perhaps middle class, white, access to some resources, rather than looking at what does it really mean to look at culturally appropriate care, what are some of the real capacity issues on health literacy or just literacy in general, and how does that impact on people's ability to manage and take care of their own diabetes. So I think one of the areas today was in terms of talking about some of the options ahead of us is really, I think the provincial government, but also organizations themselves really need to take a look at what policies that they have, whether it's a broader social policy or organizational policy that are putting up unintentional barriers for people accessing care, to really think about how those diabetes programs and policies are really looking at ensuring that we don't just have diabetes skills, but we have cultural competency skills in any diabetes team or in primary care practices, that we're taking a look at how we can implement programs that address broader policies that think about what people's income and access to transportation and childcare and housing and health and employment and income and education, and how all of that really has an impact. And I think our strategies can't be just at lifestyle behavior changes, but really need to be looking at a holistic approach and supporting individuals in making changes across a broad spectrum of not just their individual lifestyle, but their environmental as well.